The way Essentials of Care was explained to me, it always seemed like something that just made a lot of sense. And it's something I always enjoyed going to the meetings. I always enjoyed getting into critical discussions with my colleagues about how we could improve things and make things better. And I could see the outcomes. I could see that it did make a difference to the way the ward worked. One of the really great things about Essentials of Care is that it is so contextual. It is decisions coming from nurses that work on wards that make sense to those specific wards, taking into account things like the physical layout, the resources that they have, and the group dynamic. And because of that, and the fact that it's a bottom-up approach, that's what makes it sustainable, because it actually works with that ward. Essentials of Care is not just something that you go through, it becomes a part of just how we work on the ward. For example, one of the things that came out of the observation, one of the themes was around communication with the medical team, and the nurses voiced that they would like to participate in the ward rounds with the doctors. So that just led to opening the communication channels with the medical team. And it turns out that they were really quite keen for the nurses to come and participate in the ward rounds, because they had a lot of valuable information for the medical team, just as they wanted to know what was going on and what the plan was. The benefits to patient care can range from something quite specific, like a reduction in falls or a reduction in medication incidents, through things like reducing interruptions during medication rounds. But also just having nurses who are empowered and feeling that they are in control. Patients sense that, and I think one of the things about empowerment is you really have to have it yourself before you can give it to someone else. And I think that's one of the key things of Essentials of Care and how it improves patient care. It creates a solution-focused workplace culture where instead of just complaining about something, you can actually do something about it. And it's instead of just complaining about a problem, you come up with a solution.